Hi, my name is Katrina Dunn, and today I'm going to show you how to successfully insert an IV. First thing we're going to do is check our order from the doctor, and it says we're starting an IV, so that's good. And then we're going to go ahead and gather our appropriate supplies, which I've already done. And then I'm going to verbally ask the patient who they are and their birth date. Sir, can you tell me your name and birth date, please?
Darling Ryan, 10/31/51.
Okay, wonderful. And while I'm already looking at your band, can you tell me if you have any medication allergies or to tape, latex, hexadine, or chlorhexidine or iodine?
Nope.
Okay, wonderful. And then I'm going to go ahead and introduce myself to you. My name is Kat. I'm your LPN, and I'm going to be inserting an IV in you today. As I'm looking at your arm, do you have any history of trauma or falls or a mastectomy or a dialysis graft on this arm?
Nope.
Wonderful. And have you had an IV before?
Yeah.
Awesome. Okay, so I'm going to go ahead and do hand hygiene. And after I do that, I'm going to put my tourniquet 4 to 6 inches above where I plan on putting my IV. I'm going to make sure it's flat. I'm going to go ahead and make sure that it's tight enough, but I can still fit 2 fingers underneath, and there's still a radial pulse, which is wonderful. Okay, after that, I'm going to put on my goggles. And since my hands always touch my hair, I'm going to do hand hygiene again and put on my gloves. After I put my gloves on, I'm going to go ahead and clear a large area for you. And I'm going to do that with an alcohol pad. If my glove will go on for me anyway. Okay, so I'm going to use alcohol, and so since I'm using alcohol, I have to do it for 30 seconds in a back and forth motion. And apply lots of friction. And then I'm going to go ahead and let that dry. So once I've let that dry, I'm going to have my syringe pre-filled over here with saline, and that's extension tubing as well. I'm going to get my IV needle out, or catheter out. Okay, get in position. Once I get in position and this removed, I'm going to go ahead and check and make sure that the IV slides real well, and it's patent, and it is. So then I'm going to go ahead and go in the vein. I'm going to anchor it down and back. I'm going to go in the vein at a 10 to 30 degree angle. And once I get a flashback, which I did, I'm going to go ahead and go just a tiny bit farther. And after doing that, I'm going to insert the catheter into the vein and hold that steady. I'm going to release the tourniquet. Remove this needle, which I'm going to put in a sharps container right away. And after I have that done, I'm going to check for the patency of it. So I'm going to connect that pre-filled syringe I had to my IV catheter. And I do, of course, have my pinky finger on the vein up top to keep it kind of, to have pressure on it. And so I'm going to put in 2 to 3 cc's of saline, or milliliters, and it flushes real well. And then I'm going to make sure there's no blood on any side of it, which there doesn't seem to be, and get my transparency out. This is, of course, the hard part for a new LPN, is making sure you can get your transparency out without getting it all over the place. So I'm going to use the fingers I've got, then I'm going to place my transparency over the area, and make sure it's as nice and tight and wrinkle free. I'm going to remove this lining, you know, unless it doesn't like me and won't let me. Okay, and once that is removed, I'm going to go ahead and tape it, the extension tubing down. And this is also where I would normally, actually not over the dressing at all, just off to the side so it's nice and in place. This is where I'd also take a pen and actually write in my initials, the time and the date, and how large the needle was. And this was a 22 gauge needle. And the needles have already been discarded, so now I need to just remove my gloves, perform hand hygiene, and go document. Thank you very much.